Dear colleagues of the 5th Asia-Pacific Tele-Ophthalmology Conference, I greet you today from the World Health Organization's headquarters in Geneva. My name is Alarcos Cieza, and I'm the person responsible for the program on vision and eye care. And I'm extremely happy to be here with all of you today. Eye diseases are universal. If we live long enough, all of us will experience in our lifetime at least one eye disease, and very often will be many. Some eye diseases are linked to vision impairment, some are not, but all of them are linked, in most of the cases, to need for care. The good news is that in the field of eye care, there is a lot of innovation and a lot of cost-effective interventions that make possible to address all eye care needs, from promotion of eye health to prevention of eye diseases and vision impairment, and also treatment of eye diseases and addressing vision impairment, and also cost-effective interventions for vision rehabilitation. The bad news is, however, that still today a tremendous amount of people do not receive those cost-effective interventions that they need. In the World Report on Vision, we say that today at least 1 billion people is living with a vision impairment, linked of course to an eye disease, that could have been prevented or is still to be addressed. And we know that this huge unmet need for care is linked very often to availability of services, especially availability of services at community level. Sometimes is accessibility of services, sometimes is affordability of service, because despite of having cost-effective interventions, they are very often not affordable for many. And linked to this, there is many disadvantaged populations that again do not receive those cost-effective interventions. We also say in the World Report that this lack of availability, especially at community level, affordability and accessibility of eye care services is linked to the lack of integration of eye care in the health sector. The good news again is that the field of eye care is constantly innovating and is constantly moving forward in original ways to make sure that that unmet need for care is slowly addressed. Today and during the next days in this conference, you will talk about two of these innovations. You will talk about tele-ophthalmology that brings care to people's home, or that has the potential of bringing care to people's homes, and you will talk about artificial intelligence that has the potential to accelerate, for example, diagnosis and also optimize care and optimize the pathways of care. The challenge that I want to pose to all of you today is that when you reflect on tele-ophthalmology and on artificial intelligence, you really make the point of promoting high quality research, that you document those practices properly that you discuss, so that those that are continue being cost-effective and effective can be scaled up. And also what I would like to challenge you is that when you discuss those practices, you also measure them toward the extent to which they will contribute to address those challenges that I have mentioned before, to what extent they will contribute to increase the availability of services, especially at community level and in people's homes, to what extent they will increase the accessibility of services and also the affordability of services, and to what extent they will contribute to the integration of eye care into the health sector, because that will be the measure based on which we need to measure success. So live up to the standards of innovation and cost-effective innovation, keeping in mind the gap in unmet need that is still to be addressed in eye care. I wish you a successful conference and I see you next time. Thank you.